can you walk us through the differential diagnosis of confusion and what particular care step pathways might be relevant to that symptom? So as a healthcare provider, confusion can be an overwhelming symptom to work up because there's so many different things that can cause confusion. First, we should consider medications. A lot of our oncology patients are on medications that can cause confusion, including pain medications or anti-anxiety medications. So do a thorough review of your patient's med list if they present with altered mental status. Another thing to consider is disease. Many types of metastatic disease have a propensity to metastasize to the brain, and brain mets can cause confusion. So always do consider disease as well. If you suspect that the confusion might be related to immunotherapy, there are several different things that you would want to keep in mind. So first, looking at the different care step pathways, I might consider hypothyroidism. We know that a profound hypothyroidism can cause hyponatremia, and hyponatremia can result in altered mental status. Or I may look at the hypophysitis care step pathway, because hypophysitis really knocks out a lot of your hormones, and something such as an adrenal crisis would result in altered mental status. Additionally, you could consider nephritis, given that an elevated BUN alters a patient's mental status, or hepatitis with an elevated ammonia. Finally, you could potentially look at the diabetes care step pathway because any sort of hypoglycemia would change a patient's mental status. So there's a lot of different care step pathways that may lead you in the right direction for management. And the key as the healthcare provider is going to be asking the right questions. So, if, for example, you were worried about an elevated BUN causing this in the setting of nephritis, you would want to ask the patients about any other urinary symptoms, whether they notice any blood in their urine, etc. So ask the right questions to get you heading in the right direction, and then utilize these care step pathways to help appropriately grade and manage the immune-related adverse events.